Hi, I'm your moderator, Swiper Fox, and I would like to welcome you to the Candidate Show. Here, we discuss the issues of the day and how they impact ordinary Americans. Our first guest is the recently appointed Mohammed Ben Ali, representing the Libyan Health Department. He comes to us today direct from Tripoli. How are you, Mr. Ben Ali?
Fine. Thank you, Swiper. I'm glad to be here.
We're happy to have you. Now just call me Swipe. I want to congratulate you on your country's success against that evil dictator, Colonel Gaddafi. How about I explain to our viewing audience why you are here? All right?
Sure, Swipe. Go ahead. And thanks for you and America's support in ridding my country of that vermin.
Well, now, Mr. Ben Ali represents the health ministry in new Libyan government, and they want to replace Colonel Gaddafi's health programs with American ones. Does that about sum it up?
That's right, Swipe. We overthrew that dictator with a little help from our friends, and now we want to have modern Western systems.
Great. Now, let me tell you what we have to offer you in America here. First, we believe that private is always better than public. Wouldn't you agree?
Yes, that is very Western, no?
Of course it is. Now, the invisible hands of the free market always provide the most efficient solution. Just like, well, Allah does.
Okay.
What was that? Never mind. Now, we propose that you have each employer provide health care for their workers. That way you can collect the money right from their paychecks. Best of all, you can make them pay the entire bill, and there's nothing they can do about it. How does that sound?
Alright, but what about people who don't work, like old people?
Now, good question. Well, for the very old, I'm afraid the government will have to pay their bill. You know, we have to give them health care, but don't worry. You can tax the workers a small amount to cover their fees, and then squeeze the doctors for even more. This way, the cost burden of health care falls directly on the workers and their employers.
But won't that raise the cost of business and let Algeria undercut our prices?
Oh, don't worry, Mr. Ali. You're moving to a service economy. You don't need those factories anymore.
I don't know about that. What about children or unemployed people like students?
Oh, well, for children, there isn't much we can do. We have to give them health care, just like the old people. The government will have to provide for them. However, for those unemployed or the students, screw them. If they get sick, it's their problem, not yours. Just tell them to go find a job or die in the street. It builds character, toughens them up.
Swiper, that is crazy talk. In my country, we follow God's law, and God demands that we provide for weak, the poor, and the unemployed. We must give alms to them.
Well, sorry, Ben. You have to modernize and get with the new ways. If you stay with your old ones, well, you'll never advance and become westernized. It's time to turn a page in your nation's history and move on. Let's compare your current program with America's. Now, can you afford to give free health care to all your people? That's crazy talk. In the West, we know that if people don't pay for it, they just take advantage, and then everybody loses. So, paying private companies to do what government does cheaper is always better.
I wish someone had told me before I supported you Americans. Under Colonel Gaddafi, my people had free universal health care. Now they have no jobs, no food, and according to you, they should just die in the street. Maybe we should bring Colonel Gaddafi back. Good day to you, and may we never speak again.
Wait a minute, Mr. Well, I wonder what got under his little red wagon. How could he not see how wonderful our system is here in America? After all, our premiums go up by 20% a year, and our coverage goes down by 10%. In another 5 years, we will have nothing. You just can't please everybody. Well, that's our show today. Stay tuned next week when we talk about the consumer debt crisis. You know, deadbeats. And now to our sponsor. Hi, I'm Mike Ballantine, and I'm running for president. If you were going to set up a health care plan for your nation, Would you set up one that only covered 43% of your people, cost more per person than any other program in the world, and only ranked number 10 in quality? Or would you choose a universal coverage plan that delivered at the lowest price to maximize the benefits for everyone and business? The campaign to elect Mike Ballantine in 2012 believes that it is time for universal coverage in America. Our nation was founded on basic principles. Those principles are life, liberty, and the pursuit of happiness. Well, it's impossible to pursue happiness if one is ill and unable to afford basic health care. We all know about President Obama's plan to extend health care to everyone by requiring people to purchase it. But what if you don't have a job? What if you just graduated from college and you can't find work because the economy is in recession, like today? If you don't pay your taxes, your child support, fines, well, maybe they put you in jail. Will they put you in jail for not paying health care insurance? Will losing your job mean a jail sentence? There has to be a better way. With entitlement spending set to double as a percentage of outlays over the next 40 years, we need to put America on the right path to prosperity. We believe that every American should be covered under Medicare. 40% of our citizens have Medicare, and not one of them wants to give it up. Can you think of a better endorsement for a program that has been running successfully for over 30 years and cost effectively? Well, we can. In fact, we believe that by not offering Medicare to every citizen, we are engaging in discrimination. Maybe it's not a racial issue, but for the 49 million American workers that are currently uninsured, it is a very real issue. How can we say we are a modern nation with the very best health care when 49 million of our own people are unable to participate except through charity? That is a national disgrace, and it needs to end today. Nearly every nation offers its citizens universal health care. In fact, they consider health care to be a human right. The truth is that by extending coverage to everyone, we can lower the cost of health care by 5%. That's about $105 billion each year. Further, with tort reform and neighborhood clinics providing preventive care, we can lower the costs even further. If we extend Medicare to everyone, we already know what the benefit will be. In fact, we know what the cost of delivery will be and our savings that we will realize. There is nothing to really argue over except what to do with the employees of health insurance companies. This solution is so simple and neat that, well, why haven't we done it already? Or have we just become a nation without morals, without ethics, without decency? Well, what are the facts? Right now, a family of four spends on average $17,400 per year on health care. That represents, well, approximately 26.4% of their income. That family currently subsidizes the uninsured through higher premiums. We want to lower costs for people, not increase them. Under our plan, families earning less than, let's say, $75,000 a year, you'll see a savings of between $4,000 and $10,000 each year. If you're making more than $125,000 per year, you'll probably see an increase. How can we lower costs? In our program, everybody pays when they buy something. That's right, we pay for health insurance with a 10% national sales tax. It's the everybody pays plan. That means costs will go up for some people, like seniors, uninsured, and, well, undocumented workers. We believe in a fair system where everybody pays and everybody benefits. To offset the higher cost to seniors, our administration will recommend a one-time COLA increase of 5%. That is really better than what the Republican plan projects. The Ryan plan will increase costs by 43% for seniors. Under President Obama's health reform, the uninsured will be required to purchase health insurance. Under our plan, that requirement goes away. Total healthcare costs for America average about $2.35 trillion, with about 1/3 of that paid directly by consumers and 25% paid by employers. Under our plan, employers would not be required to buy health insurance or pay premiums, allowing them to lower prices or pass savings on to consumers. The consumer contribution would be significantly lowered, with just a small copay of $10 or $15 per visit, much like we do at HMOs. Finally, the national sales tax will allow states to stop collecting Medicare taxes, which eats up a significant portion of their budget, freeing up valuable funds for education and other essential state services. We believe our plan offers the best way to pay for health care and optimize its delivery to reduce costs for everyone. If we don't do this, we will continue to watch as 49 million grows to 55 million, and 55 million grows to 60 million, and then to 100 million, as employers are forced to stop offering health care and premiums grow beyond the reach of most consumers. Join with my team, the committee to elect Mike Ballantine 2012, and support our agenda to bring universal health care to every American by approving Medicare for all. Thank you for listening, and may God bless America.